Good afternoon, everyone. First, I would like to say this webinar is being recorded, and after the presentation, we have questions. We have answers to questions. Thank you once again for joining us. I am Bamidele Osamika. I'm the Regional Climate Collaborative Manager at Green Umbrella. Green Umbrella is a regional climate collaborative for Greater Cincinnati. We have been serving as backbone for environmental and sustainability work for Greater Cincinnati region for 25 years. Over the years, we've connected hundreds of members, nonprofit, businesses, academic institutions, local governments, as well as passionate individuals through our collective impact approach to tackling the most complex and pressing environmental challenges our community faces. This webinar series is titled Climate Change, Food Access, Health and Health Outcomes in Greater Cincinnati. This one-hour webinar hopes to explore how climate change impacted food production and also how food production drives climate change and how this affects our health outcomes within the region. Our panelists will provide a brief presentation followed by a Q&A. Then we have announcement and next steps. With the recent change in climate in Green Umbrella identity from Sustainability Alliance to a regional climate collaborative, Green Umbrella joins 30 other climate collaboratives across the country. All of them working on cross-jurisdictional climate action and giving our staff and existing programs and our partnerships that we have established over the past 25 years. Green Umbrella is now the largest regional climate collaborative in the country, and we are proud of that. Green Umbrella serves the 10-county region across the Southwest Ohio, Northern Kentucky, Southeast Indiana. Myself, Nubi Kennedy, who is our Regional Climate Collaborative Coordinator, and Van Sullivan, who is our Senior Director of Programs and Climate Strategy, are three main staff members supporting our climate health equity work. Alongside with us, our climate health fellows, Mitch Singstock, a 40-year medical student at the University of Cincinnati Medical School, and Leah Rose, who is an undergraduate medical student at the University of Cincinnati. This climate health webinar series builds on the recently completed report done in partnership with Scioto Analysis to highlight the findings of this report and accelerate actions on key related issues. We have released public service announcement toolkit connected to the topics covered in this webinar. Also, please visit our social media platforms and download the report to read the info. This public service announcement campaign will cover 10 to 11 climate health topics, one per month. Today's webinars is the 10th in the series. This campaign provides data and shareable materials every month. Additionally, this campaign shares actionable strategies at the individual and institutional and system levels. This month's public service announcement campaign covers climate change, food access, and health outcomes in Greater Cincinnati. Do you know that food production accounts for about 25% of greenhouse gas emissions? Changing food dietary patterns not only improve your health, but it also has a lot of environmental benefits. Meanwhile, climate change threatens crop yields in most regions of the United States. Farmers are mostly affected by the impact of climate change, resulting in destruction of our food system. In Cincinnati alone, 3 in 10 people do not know the source of their next meal. Then what can you do? What can our institutions do? We cannot support community gardening, local food production. Our institutions also should invest more in the equitable food access programs and fund our local farmers. At this juncture, I'd like to introduce our guest speakers who will dissect this topic and be ready to provide answers to a few questions. Our first panelist is Aileen Lawson. Aileen is a market manager at CAIN, is a community nonprofit located in the north side neighborhood of Cincinnati. She has been a Cincinnati resident for 10 years since attending the University of Cincinnati, and she has been working with CAIN since early 2021. She combines her background in urban planning, food and beverage services to create a welcoming, compassionate environment for all guests at the market. Our second panelist today is Madi Shera. Madi is our Regional Food Policy Council Director, and she will be here to provide some answers to some Q&A. So please join me as I welcome our guest speaker first by welcoming Aileen Lawson for our presentation. Aileen, it's all yours.
Thank you, Bamidele. Like you said, I am a market manager at a local nonprofit, essentially managing a food pantry. So I'm not an environmentalist or a scientist. I don't even really have much of a green thumb to be a farmer, but I do get to be kind of a connector between all these different professions that are interrelated with food production and food access. So if you go to the first slide. First, I did want to acknowledge that our community is located on the traditional and stolen territories of several indigenous nations. And the United States has violated all treaties with Native American nations, including the local Treaty of Greenville, which intended to establish boundary, which was not upheld, leading to further displacement and conflict. We recognize the history and its ongoing impact on indigenous peoples, and we encourage the reflection and the significance of this land support for indigenous-led initiatives, solidarity with Native nations, and the resilience and strength of indigenous communities is really a testament to their enduring spirit and highly tied to climate change and food as we talk about these subjects. So first, when I think about food and climate change, I think of it as kind of a two-way system. First, we know that there's climate change impacts on our food production. So as we see more droughts and heat waves like we did this past year, and as well as heavy rains and flooding and extreme weather events like a few weeks ago, that has a huge impact on our ability to continue to produce food and provide for our communities. There's also issues with air pollution and wildfires that threaten that availability to land and the quality of that land. But as a person that always works with people, I always consider too the impacts, not just on the land, but of the worker. So there are people out there who are creating this agricultural land. It doesn't just naturally occur. And those people do have to work within those heat waves or maybe cease their work. And those people always need to be considered as part of this system, the way that climate change impacts food production as a labor issue as well. And then on the other side of that, if you want to go to the next slide, food production also has its own impacts on climate change. So as Bamidele said, food production accounts for 25 to 30% of greenhouse gases. It also consumes quite a bit of water for both the food and the feed for livestock, energy to transport foods as we move into an agriculture system where we're producing food and transporting it hundreds, if not thousands, miles away. We are also using more fertilizers and pesticides and herbicides that have impacts on local flora and fauna and ecosystems, with runoff going into our estuaries and water systems. And all of this just to say at the end of the day, 30 to 40% of our food supply ends up as waste, either from upstream or downstream as household waste. All of those things that are having negative impacts on climate change are still wasteful. It's kind of all for naught. It's very concerning when we look at this excess of food when we look at food insecurity. So if you want to move on to the next slide. Here is a map of Cincinnati, where all the purple areas are essentially areas that are underserved of healthy foods, both because of their income, either having 120% or less of the area median income or identified as low income, low access area, but also groups that have limited access to supermarkets and grocery stores. And when we talk about food insecurity, sometimes you'll hear the term food desert. And sometimes it can be a bit of a misleading term because it describes it almost as a naturally occurring system. And really, unfortunately, it's a very intentional system. So we try to use the term food apartheid much more. This was a term coined by an activist and farmer care in Washington, and refers to a system of segregation that divides those with access to an abundance of nutritious food and those who have been denied access due to systematic injustice. And that predominantly affects people who are Black, Indigenous, people of color. And when you look at those purple shaded areas in our neighborhood, you may know those as being historically Black, historically working class neighborhoods. And it takes into account some other nuances in food access. So another term we use a lot is a food swamp. That takes into account the health perspective of food access. So a food swamp would be an area with a lot of high calorie, high salt, not highly nutritious food access points. So you'll see a lot of fast food places, a lot of convenience stores. Your food access point or main grocery store may be something like a Dollar General, and you don't have relative access to healthy food options. And that really comes down to a lack of diversity of access points and products. So if you don't have very many options to access food because there's no grocery store in your area or not a farmer's market in your area, that can really affect your food security. We also take into account transportation. So in that map, some of those yellow areas, like Indian Hill, may not have a grocery store, but the people in that area may have access to transportation to get to a grocery store. If you don't have access to a car or bus line, those really impact your ability to get to food. You also may not have a sufficient access to food storage and preparation. And that really comes down to housing access. So you may live in a smaller studio apartment that just has a kitchenette and a small fridge. So you're not able to purchase and prepare food the same way that a more affluent person may. We're also seeing a huge rise in rent costs, utility costs, and those can create unbalanced budgets. And so you may fall into food insecurity because where you previously had X amount of dollars to spend on your groceries each month, that's getting eaten away by your more immediate needs of paying the bills on time, and that'll impact your buying power to essentially serve yourself food that you need. And unfortunately, a lot of people who experience food insecurity and poverty experience it for a long time. And the trauma that can be experienced really needs to be taken into account. Not knowing when your next meal is coming, or having to make those hard decisions between whether to keep your lights on and whether to be able to go to the grocery store and buy the things that you need or that your children need. And that long-term impact that food insecurity has on people. And another term I'd like to put in everybody's ear too is a goal that we all reach for, which is food sovereignty. And again, takes into more nuances than just the term food security, whereas the right of all people to have a say in how their food is grown, and also the right to fresh, affordable, and culturally appropriate food. So taking into more account just access, but also making sure that access makes sense to you as an eater. Next slide. And with people who are food insecure, we often see a list of chronic health conditions and disease that they experience much more than people who are food secure. So a lot of these things we see are hypertension, heart disease, diabetes, obesity, not being able to have the choice in the foods that are available to you. So unfortunately, you may only be able to choose between things that are high fat and high salt, convenient to you and affordable to you. And those things aren't going to be great on your health. And again, going back to what I said before about the trauma that's experienced, we do see a higher rate of mental health disorders among people who are food insecure. And that is kind of going to go back and forth, because if you cannot feed your body, then you're going to have a harder time, maintaining your mind to be able to perform at work and take care of yourself and your family members, and pay attention in school. And all this too, essentially, is we talk about the concept of food as medicine, and then it creates a cyclical impact. So if you are experiencing some of these chronic health disorders, or even outside of this, you fall into having a disability later in your life, and then you become food insecure, that now takes away your autonomy and access to a type of medicine. So you aren't able to treat your disease with your diet of having lower sodium, lower fat, healthier, fresh ingredients, white meat over red meat and high fat meats, because it's just not an access to you. So you're just going to, unfortunately, have to worsen your health impact, your chronic illnesses, because you just don't have access to that type of medicine. The next slide, please. So back to reining it back in and talking about how food and climate change, environmentalism all are interrelated. Often we hear certain recommendations about how you as an individual can reduce the climate impacts of your food choices. But they don't always include the type of people that I get to work with. So they can include a lot of assumptions that exclude those who have a lack of access to the same resources as maybe a more affluent household may have. And so I'm constantly looking at things through the lens of, well, how would that work for the person I'm seeing tomorrow who is reliant on Social Security, or doesn't have access to a car, or any of these types of barriers that a typical person can experience that does lead them to be food insecure. So one of the things I hear a lot are telling people to eat less meat, or buy local, or buy organic, but that really ignores people's lack of choice within the grocery stores and access points that they have available to them. It also ignores their buying power to make those choices, and the quality of the stores that they do have access to. So in my market, we supply all of our food either through what's available from the free store or through food rescue. And unfortunately, we don't have a lot of protein choices that aren't meat, or a lot of the meats that we do have don't work for people, or those high in pork and things like that. And they're not able to quite make those same choices, especially when you look at locally produced or organic foods. Those are going to be higher in price. You're going to see those in stores in more affluent areas. And people may not have that choice to consume those, even if they want to. A lot of misconceptions I find is that people assume that a person who may be food insecure doesn't care about that type of stuff. They don't care about knowing where their food came from, or whether it's organic, and that's far, far, far from the truth. We also have an assumption of access. So we say good recommendation is to buy your produce and perishables in smaller amounts, and just go to the store more frequently. That'll really cut down on your household food waste. But it assumes access that you have to a grocery store nearby and the transportation to get there and back frequently. That that doesn't quite work for most people, even though that may be what they would desire to do and would cut down on their local food waste. And back to both these, even you think of like, oh, well, what about a neighborhood farmers market? That's right in their neighborhood. We have one right next door in North Side, and they take SNAP and WIC and produce perks. But a person's overall understanding of the presence of that farmer's market, how it works, and their comfort and empowerment to shop there may be limited. It's quite different than a traditional grocery store. Again, people who experience food insecurity, this does affect a lot of our Black and brown neighbors at a higher rate. And if you go into a place that nobody looks like you, that is going to affect your ability to participate in that market. Another great option for people who can do it is being able to garden at home or use a community garden. And that's a great way to make decisions too on the foods that you have access to. Reduce your travel time to get food. You have more authority about the food that you do consume. But this does assume that people have the space to garden at home. A lot of apartments, multifamily units, things like that, they don't have any private outdoor space at all. Community gardens can have long wait lists. They may not be representative of the community that they are located in. Too, with composting, there's similar barriers. And added to that, if people are already living in poor quality housing that has issues like pests, odor, other pollutants, they may be apprehensive to compost at home. And then afterwards, they may experience barriers in transporting that compost, financially supporting into a system that they can send their compost off to. Some of these solutions just don't account for a great vast of people that don't have the equal access to the resources as some of us do. But it's not all bad. Next slide. So like I said, I get to interact with a lot of different types of people in the food system. And I wanted to highlight a few that I get to work with that I see really making a positive impact on sustainability while providing greater food access for those most vulnerable in our neighborhoods. First, there's been a huge rise in food rescue organizations and food rescue as a belief in the last couple of years, ever since COVID really I've seen it grow. They are creating infrastructure to bring what would otherwise be wasted food to what I would say is a last stop food access point, like myself or other a soup kitchen like Our Daily Bread. They also provide something that's really important, which is education to stores and institutions like schools and hospitals, office parks, on the importance of food rescue, how to reduce their food waste, provide them strategies to both mitigate their own waste and a way to redirect it so that it can go into the hands of people that would love to have it. This is, like I said, a part of a growing consciousness and effort to reduce food waste. But I always have to bookend this with saying it's not ultimately the best solution in the long term, but it really is providing a mutually beneficial right now solution. And I say that because taking others' leftovers and doling it out to those who maybe are resource insecure does confront some issues we have with human value and dignity. And also as stores reduce their food waste, which is what we want, that also means resources are going to start to be reduced in markets like my own. The last one, Society St. Andrews Gleaning Crew, really provides a unique opportunity for reducing food waste, where they're reducing food waste from the grower point, from crop waste. So when crops are not profitable, be harvested and sold at market, or there just isn't a market for it anymore, the best option for the producer really is to let them rot on the vine. It'd be a waste of energy and resources to glean it, to pick it all, harvest it, and then just let it go to waste anyway. But Society St. Andrews, they use volunteer and a small but really mighty team of employees to go out and they harvest these crops, and then they immediately distribute it to local agencies like myself or a kitchen. And this is such a great solution because it confronts issues of both wasted food, but also energy and farm labor that otherwise would have been wasted. And we're able to get really fresh local crops, which is not something we see a lot in a market. Like I said, we deal mostly with big state level, like higher level food distribution or food rescue, where we're getting at the end of the line. And this really is not that. And the first one of access to local producers that I get to work with, leveraging the Ohio CAIN program has been great for addressing the need of getting fresh local produce into our market. So the Ohio CAIN program supports food banks to receive a consistent supply of produce from local producers. And then it has a return benefit on the producers where they're guaranteed those funds every year once that contract is made. So if there was an unexpected loss or decrease in production, as they may face as they deal with the impacts of climate change, they're still guaranteed that. So next year they can still seed and sow just as much produce as they would have if they were produced in full. And so that way we're able to kind of keep agricultural afloat in a way as they face the, insecurities that climate change has on agricultural production. But there's also a really cool way it can be utilized in a smaller scale. So what we do, we leverage that program to work with Mustard Seed Farms, which is a local farm located just around the corner from us past Spring Grove Village. And we're able to source directly from them high quality, locally produced produce. And we order it based on the preferences of our community, and we distribute it right after it's been harvested. So we're able to get things way further ahead than what we're used to at the end of the line with food rescue. And we're able to purchase produce that reflects the community that we serve. So we have more than half of our guests now are immigrants from Central and South America, and their palates and diets and familiarity with food is going to differ quite a bit from the American diets. So I'm able to purchase a lot of cilantro and a lot of radishes that are staples in their diet that we don't always see coming in through, statewide systems. We also are co-located with the Northside Farmers Market, and people in our neighborhood are able through that to leverage produce perks and senior farmers market, and that increases their buying power at the farmers market. So they're able to buy local, fresh produce, talk directly to their producers, privileges that really aren't always allotted to people with limited food access, and really strengthen our local food system and bringing in more people to participate in that. This year, the Northside Farmers Market got funds from the city of Cincinnati through Seeds of Change for their Northside Farmers Market for Everyone program. They were used that to fund vouchers or coupons or whatever you want to call them, and to be distributed at market. And this really addressed an issue that we see a lot. Like I said, a lot of our guests are immigrants. They're not entitled to SNAP or TFAP or Senior Farmers Market. And so they're really disenfranchised from those systems that are supposed to increase their buying power at the market. So we distributed these vouchers. About half of them did go out to these immigrant guests, and they were able to use those at market and really bring people into a space that they may not be familiar with, and give them access to food all at the same time. And outside of CAIN, something I just wanted to highlight of happening in our city that I admire so greatly is an increase in local grocers. So local food access points that are run by and include community members are so crucial to a lot of things, to diversity of choice, to reflecting local buyers' choice, educating consumers, increasing people's ability to make frequent stops when there's a grocer in their neighborhood, reducing their amount of transportation to and from the grocer. So the first two, Queen Mother's Market and Misers, really focus on providing access in underserved or disenfranchised areas, like Walnut Hills and Lower Price Hill. And those food items that they provide to their community are either reduced in price through a buyers club model, or sometimes even free. And those leverage something really powerful, which is the power of community. And they're able to use food too to check in on their neighbors and strengthen their community and really build upon their social capital that they already have and is there, and provide food for each other. The third one, Lear's, is located in North Side, and they're able to, as a smaller grocer, really take sustainability as the forefront of their business model and lead by example. So they focus on locally or ethically produced low waste items. And all of these I wanted to highlight because it is an item included in the Cincinnati Community Health Improvement Plan. So I'm really hopeful that we'll see a lot more of these smaller local grocers popping up, and that people really understand the impact of why we need more of them in this neighborhood. Next slide. So I just wanted to kind of cap this all off with highlighting some maybe longer term, higher level investments that I see as being the highest impact that we can make on both our climate change and food systems access points, and really helping us provide for our community in those ways. So the first couple of things we could provide to how we produce and access food by diversifying productions and processing of food, getting away from having only a few really large scale producers producing all of our food, and kind of diversifying that, allowing smaller and medium-sized farmers into the system, also supporting more local grocers and markets. We should also support those who are historically disenfranchised to make their own choices of their own foods by expanding and updating food access programs like SNAP, EBT, TAMP, WIC, and ultimately increasing wages. We really are underpaying our folks, and if we increase their wages, they would have more autonomy to participate in food systems, maybe buy local, maybe buy less meat, buy from your farmer's market. And finally, supporting the producers and those workers within our agricultural system. So having more workers' protections for the people who are out there having to face climate impacts firsthand. Like I said, working on a farm in a heat wave, there's no escape from that. And we really need to protect those workers, and also providing some financial supports for producers if their yield may be impacted by climate change, because ultimately, I think the facilitation of more choice for the consumer while supporting some smaller and medium-sized producers will lead us towards a path of success and growth. And I did want to, I understand that we planned this on November 6th, so I wanted to acknowledge that. And fighting these big higher level systems may feel a little impossible today, but all these things can be taken down at a local level. And I really highly encourage anybody who's really feeling down about today to take a breath and maybe go out tonight and go to your favorite restaurant, or go to your farmer's market, or invite a neighbor over for dinner. All of those are still investments in providing better food access while being something that you can attain right now. I'm always saying that I'm very fortunate that no matter what, I get to go the next day and somebody's going to come in and ask me for food, and I get to provide it. And I feel like, I got something done that day when we get these impossible feelings like we have today. So yeah, that's all I had to say before the Q&A. I wanted to at least end it on a bit of a positive note.
Wow, that's a lot of information. Aileen, thank you very much for those wonderful presentations, and thank you for those local solutions you flagged the course of your presentation. Really appreciate that. We hope our audience and our attendees will kind of use all these resources and going to help them, always. So I think this is a Q&A session, and I just want to let the attendee know that, or anyone kind of seeing this recorded video afterward, that if you have any question, please, you can send it across to us, either to me, Bamidele, or to Madi. We can follow up with your question. So for the attendee on the call, please, if you have any question, you can drop on the chat note. We're going to capture that as we enter the Q&A session proper. So Madi, I think I will have to push this question to you. First of all, is the first question is, how can we ensure more resilient food and system in Greater Cincinnati? I know CAIN is already doing a lot. So, and Aileen has said a lot of local solutions. So I just want to look at it from the regional perspective. How can we ensure more resilient food system in Greater Cincinnati?
Yeah. Oh my gosh, it is hard to follow Eileen's presentation because it was so comprehensive, and I want to also kind of start out my response by giving a huge thanks to Aileen for sharing with us today, because it was just full of so much care and thoughtfulness, as well as, giving us a lot of really useful information that had a lot of nuance and a bunch of resources. So I'm fortunate to say that Aileen is a member of our Food Policy Council, active in our Access and Education Committee and some of our other working groups. So we're really so fortunate to have Aileen as a collaborator in general, but especially today, like we were saying, with so many big feelings. And I guess that would kind of lead to my first answer to your question, Bamidele, about ways that people can get involved and what's going on at the more regional level. So CAIN, mostly serves a Cincinnati-focused audience. Green Umbrella and our Food Policy Council are regional with a footprint of 10 counties. I think there was a map earlier in the presentation, across the tri-state. So there are a ton of examples, in addition to the many that Aileen shared, across our 10-county region. In every little neighborhood and every municipality, there are people working on these issues, and some of them are on the call today. So I know many of us here in the participant list are some of those people. But the Food Policy Council is one of the hubs or spaces that tries to connect folks working in these areas and help facilitate, information sharing, communication, collaboration, strategizing, and action, as well as policy advocacy. So truly taking the easy way out by saying, we are a resource and you can get involved in the Food Policy Council. We would welcome anyone who's interested. I will put our link to our webpage in the chat in just a second, but we have a bunch of activities that are changing based on who's involved, but we are getting ready to kind of plan ahead for 2025. So there'll be a lot of opportunities. This is a really good time to engage. And a couple other things that I wanted to say that kind of relate to some of what Aileen shared is, Aileen mentioned this briefly, but we have the process of community health improvement planning, which is basically a planning and sort of strategy setting process that our local and regional health departments take on every few years. And I know there's some folks from some of our local health departments, as well as even our state health department, on the call. So they might even be able to chime in if there's more details to share. But every few years, there's this process of community-driven planning, and also a lot of data collection and analysis that goes into identifying what do we as a given community want to do to address our community's health needs. How will we do that? And it's kind of a guiding frame, a guiding plan for the health department, but also for all the other partners in the community, organizations like Green Umbrella and CAIN, and a bunch of the other organizations that Aileen talked about in the presentation today. are called to kind of get involved, not only in creating the plan, but in executing it. So the city of Cincinnati is in the process of doing their community health improvement plan for the next few years right now. And there is a food and nutrition section. So there's going to be some really exciting and pretty audacious goals that come out of that. One of the ones that we're working on, and there's several, but one of the ones we're working on is getting some clear data that we can track over time related to food access and health, and also trying to get institutions and organizations like the city of Cincinnati, but also other community organizations to adopt guidelines and practices related to serving nutritious food, serving local food, serving culturally appropriate food. And not only is this happening in the city of Cincinnati, but Hamilton County, Ohio is doing a similar project that we're contributing to in the We Thrive communities of Hamilton County. So this is something that's part of actually a statewide and a national push to help communities address some of the issues that Aileen talked about, and not just an individualistic approach of like, you do better as an individual, but how can we create environments and policies that support those choices and have resources and commitments at all levels to make those choices possible. So those are a few examples. I also think it's worth mentioning, because of our topic today, that something the Food Policy Council has been really focused on this past year is connecting those public health endeavors related to food and nutrition with our environmental and climate planning and action taking measures. So we have the Green Cincinnati plan for Cincinnati, and we have a regional climate plan and playbook that's in development right now. And so we're kind of trying to put both of those planning and action processes at the local and regional levels together so that we can be addressing climate, nutrition, and health all as one. And so, and Aileen did such an amazing job like connecting those pieces, which is my daily mission and daily struggle. So I'm going to truly take the recording that we got today of your presentation, Aileen, and share it as kind of the onboarding for many of our folks that we welcome and work with. So I'm really so appreciative of that. If you know me at all, you know I could go on and on. So I'm going to stop there and see what other questions we have.
Thank you, Maddie. Thank you for providing those information updates on how we can become more resilient in our food system within the region. So Aileen, I would like to ask you this question about, I know you guys are already doing so well at CAIN, and how you kind of provided some local solutions to enhance our food system. So I just want to ask that how can we enhance a consistent food access to vulnerable individuals in our region? Vulnerable, the seniors, the children, and others. So how can we enhance a consistent food access to these folks?
Like I said, yeah, I work at such a local micro level. And so for like me personally, when I'm thinking about the market and how I can increase our access, I really think about diversity, trying to meet people in lots of different ways about where they're at. So we try to have a really diverse amount of resources coming into our market. We have people who are vegan, we have people who are native Guatemalan, who are Appalachian. Those are all different diets, and we try to have something for them. And we're looking towards the next couple of years of maybe diversifying the ways that we provide food. So delivering to people who may be homebound, or doing pop-ups in schools or apartment complexes to kind of overcome that transportation barrier. And always providing as much choice for people. You really should be listening to your shoppers to tell you what they want. And that has a great impact on access. It also has a great impact on waste. So if you just hand somebody a box of pre-packed food they're probably not going to eat all of it, and then it just ends up back into the waste stream. So if you give people a choice, kind of the twofold benefit. And also kind of at a smaller scale, like don't doubt the impact that mutual aid can have. So like I said at the end of my presentation, sometimes we get drowned out in these like big picture things, but there's a huge impact of just like connecting with somebody on Facebook and like making them a meal and delivering it to their house. Like that's great. And because one day you're going to need it back too. And then at a higher level, like bigger, harder to attack things. I said like really advocating for higher wages, more benefits for people, increasing their ability to interact with the food system the way that all of us, maybe more privileged people can do. That's really like at CAIN, everything kind of ends up being intersected with like fair pay and access to housing, because once those things are stable, people are able to, access even more resources and, address even more issues that they may have experienced in their life.
Great, thank you. So I think I have like my last question here is how can our institutions do more to enhance food security? I put this question to both of you, but I think Maddie, maybe you can just come first and let Aileen talk about it later.
Yeah, here I am trying to write things in the chat. Which the thing I was trying to write is, if we have time, we welcome questions from everyone else attending as well. So you can put them in the chat or raise your hand. But what can our institutions do more to enhance food security? There's a bunch of things, and Aileen kind of talked about some of them already. I think this again is where our Food Policy Council is a great resource, and several of our partners as well. So in the recent past, we worked with organizations like American Heart Association. I mentioned Hamilton County Public Health, and a few others that we work to, and also now the city of Cincinnati, kind of in that planning process that I mentioned, to help provide like guidance, resources, guidelines that community organizations, businesses, large institutions like universities and schools can adopt. And so historically, some of those have been focused on purchasing local food because that usually offers really high nutrition value as well as lower, emissions, and it helps, boost our local economy. But we also have resources related to health and culturally appropriate food, like I mentioned. So pretty soon, in the next month or two, I think we'll be launching a menu of options for organizations, kind of starting from the easiest, most straightforward, simple thing you can do for your organization to more elaborate, larger commitments, like making a public commitment to procure X amount of local food. And there's lots of different programs that can help with that. So keep your eye out for that. And you can also always contact us directly to get support. Especially, we love to offer that kind of one-on-one coaching for our Green Umbrella members and our partners in the Food Policy Council. Generally, some things can be, if you are an organization that has funds, you can fund and support different programs and projects like the ones we've discussed today. So Aileen talked a little bit about the city of Cincinnati funding the Seeds of Change grant, and I think that's a great example of what institutions can do. There's a lot of advocacy to be done, and I think probably with election timing yesterday, some of us might be worn out from advocacy for a few days, but we got to get back at it. And so there's a lot of programs related to equitable food access and nutrition and in climate that we rely on policy decisions to make those things happen. So joining us in advocacy there. And I know there's some folks who are affiliated with research institutions, continuing to support that kind of work that's serving the needs of the communities is really important. So those are some of the things that come to mind. But again, we are a resource for you. We're here for you. And this is kind of our bread and butter. So specifically with the regional climate collaborative model that we have now that Bamidele talked about at the beginning, serving our member institutions in these kind of policies and programs is really what we're aiming to do. So reach out to us.
All right, thank you. And Aileen, you have some thoughts to add to that?
Yep, Maddie covered quite a bit of like, what institutions can be doing. For me, as she was talking, it just made me think of like a lot of these institutions I do engage with, even if we're not like doing direct work, and don't want to diminish the value of just like perspective. So I've been able to talk to people from like the city and the county, or people who are doing research at University of Cincinnati, about what I see and what the people in my community are experiencing, because it really can shed some light that they otherwise wouldn't know about, because a lot of these institutions aren't working directly with people. They're relying on research and information gathering and data gathering from other places or research projects or things like that. So really like elevating the voices of my community and presenting, their struggles. And then at CAIN too, we have kind of like a sponsor, a group of people. It's called the Poverty Liberation Collective. And so that is a collection of people who live in poverty, who again would be food insecure, and empower them to raise their voice and create advocacy plans and projects to bring up to institutions. That's one way that we as nonprofit are able to like leverage the resources we have to engage with institutions. And so I guess I'm kind of answering this backwards, but I guess what institutions could do more is listening, I guess, more to local agencies and involving them to kind of get their perspective. And I appreciate that's what Green Umbrella does, and my experience with Hamilton County and the city. They do a great job of, because it kind of is like we can match, what our strengths are. They may have the staff and the funds to do a lot of this research, and then we have the direct access to people and their real experiences. So we kind of marry them to create a solution that's like actually going to work, and just theoretically going to work.
Thank you, Aileen. So moving forward, what can institutions do? What can individuals do to adopt climate resilience strategies to improve food access? One individual can support or start a community garden, as Aileen has said, and Maddie has also emphasized that too in their presentation. Individual can support local food stores market, and they can talk with the elected officials to support policies that will improve food system. Also, we also add to this thought that individual can as well support plant-based diet. So what institutions can do, institutions should provide more fund and implementation programs for sustainable agriculture, invest more in equitable food access programs, and support policies that aid sustainable food production. And we have a couple of announcements to make. Next slide. So we have by November 8th, we have Meet Green Space hiking series, which is going to be at the Bender Mountain and Ottoman hike by between 3 to 4:30 p.m. We also have Covington Climate Advisory Group Showcase. We have been having having some engagement with City of Covington and Northern Kentucky. So we're going to be having a showcase of that, we're going to capture all the workshops that will be done. We'll be doing and next week and Wednesday 13th. So we also have by November 14th. That one's going to be between 5:30 to 7 p.m. So we have November 14th. We have clean energy funding opportunity webinar, which is going to be between 12 to 1 p.m. Please visit our website to kind of sign up for these events. We also have our climate and health webinar series, which is going to be the last for this year, which is coming up by next month, December 2nd. First Monday is going to be on waste and recycling and how these impact on health outcomes within Greater Cincinnati. So it's going to be the same time, noon to 1 p.m. and December 2nd. Please join us, register for these events. And the last one we have December 10 is the annual event and a meeting celebration. So it's going to be a digital future building between 5 p.m. to 8 p.m. Please join us to celebrate our annual meeting. So we hope that today has been so great. Please log into, join us in what we are doing as solutions by visiting our website, sign up for our events and participate. I hope you enjoyed. See you next week or next month for another exciting topic on our series. Thank you.